It's sort of a funny topic when we're talking about cancer prevention because this isn't really prevention, but it seems to fit in more with that. It's more preventing unnecessary treatment, unnecessary harm from treatment. Depending on the study, about 17% of men are going to be diagnosed with prostate cancer in their lifetime. Fewer than 3% are going to die from prostate cancer. So the vast majority of men, we always say, they're going to die with their disease, not from their disease. We find that there are a lot of men who die from other causes who had small amounts of undiagnosed prostate cancer. It may be as high as 50% or higher for men in their 80s that actually have prostate cancer and don't know it. Some of that's the basis why we don't get as excited about prostate cancer the older patients get, sometimes much to their dismay, but because we know that most of these men aren't going to actually die from it. There's been a real push to try to decide what factors can help us find out who's at risk of dying from prostate cancer in the future. So it's less about all the diagnosis, maybe less about prevention, but once these biopsies are done, how do we decide who really needs treatment, who needs to be cured, and who would maybe be one of these guys who just go on to live the rest of his life with no problems? But it's this idea, this long window of curability. There's a long period between when you're diagnosed that nothing needs to be done. So unlike some cancers where we know we better be getting in there in a week or two or a month, with prostate cancer, we've done a million studies that show we're not in any hurry. Just because we found it doesn't mean you need treatment next week or next month. One other topic I want to bring up for some people who may or may not be aware, there's this term that's been used for a long time, this watchful waiting. And what we're talking about now is active surveillance. Yeah, on one hand, it's really just semantics. It's just terminology. I think it's more than that. The watchful waiting in the past has always been you got an older person with a lot of health problems, and what you say is we're just not going to treat it. We're going to leave you alone and watch you, and by the time you progress to some kind of symptoms, we'll just put you on your hormone medication that'll slow the cancer down. Active surveillance is a really different concept. We're trying to find men who really are good candidates for curative treatment, guys who could have surgery, radiation, cryoablation, but maybe everything's so favorable that they don't need treatment. And we're going to watch them very closely so that as long as everything's stable, we don't have to do anything. But if there's any sign that it's beginning to progress, at that point in time, we can still do some potentially curative therapy. So it's very different. It's seeing if you can get away with not treating it, but then still trying for a cure. So just to really summarize, selected men with low-grade prostate cancer, very favorable risk, can initially avoid treatment if we're going to closely watch with frequent PSA, prostate exams, and routine prostate biopsies. We really believe that the risk of the cancer progressing beyond our ability to cure it is very low on this type of a protocol. And maybe as many as 80% of men with favorable risk prostate cancer can avoid the risks and the side effects of treatment for years or maybe forever by following in this kind of a program. Thank you for your attention.